So, a lot of our clients will come in complaining about tennis elbow or golfer's elbow. If you just rub the area that hurts, it will feel better for a little while, but it won't really produce long-term results. So what's missing in the treatment that could really help them to feel better in the long term? Let's find out. So keep in mind for both tennis and golfer's elbow that they are really inflammation of the wrist extensors or flexors. So tennis elbow is the wrist extensors pulling, and there's basically a tendonitis of those muscles attachments right on the lateral epicondyle of the humerus. For golfer's elbow, it's going to be essentially inflammation of the wrist flexors on the medial epicondyle of the humerus. So all of the forearm work we did in our carpal tunnel video is absolutely going to apply here. The difference is that when we get to enhancing, i.e. either passive movement or active movement, instead of focusing on moving the fingers and hand, we're going to focus on opening and closing the elbow. In order to make that work, we're not going to think about myofascial strokes because I can't really do a myofascial stroke comfortably in here while she's moving the forearm, right? Because it'll just throw me off. So instead, what I can do is more of a pin and stretch idea. So I can grab her forearm in such a way that I'm holding trigger points in the tissue. I'm squeezing and using one point of contact. First, I can passively open and close the elbow. I can also rotate and unrotate the forearm. And basically, I'm just going to take this finger and move it around and find different trigger points. I can use my thumb to do that. And I'm thinking very close to the medial attachments, so this would be more in relation to golfer's elbow. On a scale of 1 to 10, what does that feel like?
7.
All right, 7's not bad. And so basically, I'm just working my way through the varying tight points I'm feeling in the tissue down here while opening and closing the elbow joint. Now, another thing about golfers and tennis elbow that we're going to talk about, and this sort of secret sauce we talked about in the carpal tunnel video as well, is that the rotational muscles are really going to be a big factor in this. And if they're overly tight, tennis elbow really usually comes from that putting spin on the ball twist of the forearm than it does just from the straight shot that's happening. And same with golfers. There's a little bit of a twist that happens in the stroke. And so working on not just opening and closing the elbow, but also opening up that rotation in the forearm is going to be very helpful here. And so I really can work around this whole area while opening and closing for golfer's elbow. For tennis elbow, I can come to the other side and I can squeeze in the back. So the first side I was squeezing using my middle finger here. With the same hand shape, I switched to squeezing with the thumb, and I'm getting more of the wrist extensors. Okay, so that's one way to work on the forearms differently than we did in our carpal tunnel video, which was much more focused on myofascial release strokes. This is more of a pin and stretch technique. Now that we've done some work and opened up her forearms, we also want to think about the biceps and the triceps. So the biceps, from here, we also can sink into brachialis, which is the really big power muscle at the bottom of the humerus that really is what we think of as the bicep muscle. And again, what I notice the most is as I press into her bicep, her forearm rotates. And those two things shouldn't happen together. There should be the ability to flex the elbow without that being attached to rotation of the forearm. But given the fact that she types a lot, those two things are kind of getting tied together. And so as I'm opening and closing the bicep here, which probably doesn't feel that great, I also want to think about rotating the radius away and not letting it continue to rotate. And so I'm trying to rotate the forearm into a palm up position. And there's going to be all sorts of stuff you feel down in here. A little millimeter in one direction to the other might change it pretty radically. I just shifted about a millimeter that way and it lit up like a Christmas tree and got real zingy. And I notice her breathing's got to increase to handle the increase in intensity. How are you? Still with us?
Yeah.
Ooh, hi there. I found right in there a really tight part of the biceps, and this is part of biceps brachii. So the brachialis is the big power muscle deep to all that. This I'm feeling right there is one of the heads of biceps. And so now I'm going to get in on that, and again I'm just going to open and close the elbow, but I'm also working on unrotating the forearm at the same time. And I'm just going to continually traction down, because as I'm working up here, her shoulder's going to want to lift in response to this upwards pressure. So I just want to continually be tractioning that back down. Ooh. Hi there. And one muscle that often gets left out in client treatment is what we colloquially call the handshake muscle. And basically what that muscle does, we call it the handshake muscle because it puts the hand in this position. If you go that way, it will tighten to return it there. If you go that way, it will tighten to return it there. And so that runs along this line here, and we can just fascially open that down towards the elbow. And this is definitely going to be a factor in tennis elbow. Ooh. And what I just felt on her was a little bump right where the rotation muscle meets the thumb muscle meets that muscle. So there is a little bit of gunkiness kind of tying those three structures together in a way that isn't all that ideal. Great. And what I'm hoping for at the end of all this is that that elbow rests way more open, which I definitely see. When we started with her, it was more like that. And now it has this ability to fall much more open. So we showed a bunch of different releases where I was just doing work myself simply and then passively moving her elbow for her. Now I'm going to have her actively move it as I'm doing these techniques. So the first one again is essentially a squeezing where you're pinning the muscle down near the attachment of the golfer elbow side, which is that medial epicondyle. And all I'm going to have you do, Anne, is basically open your hand and fingers long. And yes, I would like you to rotate palm up. And now just open your elbow slowly. And close it, and just keep doing that. And I can do that both on the flexor side. I can also do that on the extensor side back here. same thing. So for her to open and close, I'm gonna contact here for the wrist extensors with my thumb there, and I'm just gonna have you open and close your elbow. Yep. And I can use this hand to keep her from running away. Yeah, there you go. Cool. Before I was passively moving the forearm while I was in brachialis, but with a lot of clients, if, for instance, notice that if I press into her brachialis, it's going to lift her forearm several inches off the table. That's indicating a pretty tight biceps, pretty tight brachialis. So I'm going to do that, and now what I'm going to have you do is just very slowly try to open the palm face up and slowly bring it down towards the table. And as she's doing that, I can myofascially move up through the muscle. And let's do the same thing again, this time with the long head of biceps. That's no fun. Great. And I really like doing active work with clients because it really helps the proprioception of their brain change and understand what needs to fire in order for other things to loosen. There's lots of ways to work on triceps. If a client is face up, this is one of my favorites for the therapist's body mechanics, is basically just to have the client in this position, which is starting from here. You can lift the arm up, bend the elbow, and you can either have them go palm down onto the table from here if they're open to that. She's pretty flexible in her wrist. Or you can have them grab the edge of the table ever so lightly there. For her, since she is open, I am going to place the wrist down here, and I can just do myofascial strokes straight down from the elbow to the shoulder socket for triceps. And tri means three. There are three distinct heads here. Nice. All right. So we showed some ways to open triceps from the supine position, but it's always generally easier to work on triceps in prone position. So we can also work here. So basically what's going to happen is now I've got her triceps easily exposed. And if you can see, as I press into the belly of her tricep, her hand and forearm are lifting away from the table in response. And so I can just start with a very basic myofascial stroke here. just like we did before. And I can also make sure that I'm getting all three heads from here. And I can enhance this by passively stretching and shortening her tricep muscle as I'm working on it. And I can also have her do the work for me. So if I contact in here, and what I would like you to do is essentially the same kind of thing I was just doing passively, but now you're in charge. So you're going to lift a little bit away and then towards. Nice. Great. So there's several new muscle groups to think about in your treatments with both tennis elbow and golfer's elbow. If you like this video, please subscribe to our channel for future updates and hit the like button. And we think you'll like this video too.